Good day, my name is Dr. Rapiti. Again, another story for my day, another patient with a very interesting presentation, and I'm presenting it because it reveals how foxing COVID is, and I was almost beat. And I'll first get my patients to tell us what he came to see me for, what was his symptoms. So Mr. Press, tell us, what did you come to see me for today?
I just went to the doctor because I was so short of breath.
Now, how long was the shortness of breath?
It's more than a week now.
Well, how did you notice you were short of breath? What made you feel short of breath?
Especially lately, I couldn't even put on my pajamas and I got tired.
That's right. But you're also a patient with hypertension, you got diabetes.
I've got diabetes and hypertension and heart problems.
And you had a heart problem.
That's right.
And you had no flu symptoms.
No, I know the flu symptoms.
Okay. So you can look from this history. Here's a man with hypertension, heart disease and diabetes. Suddenly says he's got shortness of breath. And he's got no flu symptoms. My immediate reaction is that probably he's got cardiac failure or a heart problem. And I asked him if he had any flu symptoms. He said just had a mild cough last week or so, nothing serious. He didn't even know what a flu symptom was. So I checked looking for his heart function, whether he had an arrhythmia, whether he had cardiac failure. And as I listened, I noticed that he had creps in the upper part of his body around here. Now if he had heart failure, the creps would be at the bottom part. And this happens when you have COVID pneumonia. But when he had it on the upper part, it made me suspicious. So I went on to do a peak flow, which is this, and it could not even blow 100. Then I tested his oxygen. He was 84. And so the short duration of shortness of breath, the oxygen of 84%, and the low peak flow made me suspicious that he had COVID, which in fact he does have. So one must be careful and don't expect to have the typical symptoms to make a diagnosis. One must have a high index of suspicion when anybody presents with a sudden shortness of breath. If you look at Mr. Press, he looks very comfortable. If at this point and you would think, right, he's quite happy, he's not distressed. So anybody looking at an oxygen level of 84% would get alarmed and say, we should get him an oxygen. And I think this is where we should make the point that we don't treat readings, we treat how the patient can cope and how it can function. Mr. Press, with that 84%, is able to drive, he is functional, he will get better. And what I've noticed with the elderly, they don't get whopping pneumonias like the middle people that are young adults or older adults, because the immune response of the older people is far less, so they don't get what is the typical overwhelming cytokine storm. So in some ways they are spared. That is why for these last 2 weeks he had a consolidated area of pneumonia, not the entire area. And I'm quite sure I put him on treatment for his pneumonia. I wasn't going to take no more chances because it's not getting progressive. But I'm quite sure he'll do well. It will take time, but he will get better. I hope you learned something from this video, and be careful again. The take-home message: shortness of breath, suspect COVID until proved otherwise. Thank you, Dr. Rapiti, Cape Town, 10th of July 2021. Thank you.